Hi, everyone. My name is Sonia Basroy, and it's my pleasure to introduce you to Dr. Fatima Iqbal. Did I say Fatima right? Is that
Yes.
right?
Yeah.
Um, Dr. Iqbal is a board certified internal medicine and obesity medicine physician and the founder of Crabtree Health, a primary care and weight management practice based in Morrisville, North Carolina. And today we're going to be discussing navigating women's health in midlife as a South Asian woman. So welcome, Dr. Iqbal. If you want to go ahead and introduce yourself, and then we'll get started with some questions. And if anyone has any questions, you can just unmute yourself and go ahead and ask.
Yes, absolutely. Well, thank you so much for that introduction. And I appreciate everyone who decided to take time off and join this presentation. I want to talk a little bit about what got me started into looking into women's health. I initially, once I finished my residency in Ohio, started off as a physician at Duke Primary Care. So Duke is a big employment system here in Raleigh, North Carolina. We have a huge network of UNC, which is the University of North Carolina, Duke, and then you also have Wake Med. So we have three big systems here. So I became part of the corporate medicine system with Duke. I started off working in their primary care realm, and I had a lot of women in my panel. And so the physician that I took over, she had a lot of older female patients. And as she left, they were left pretty much baffled into what's going to happen next to us. And so just going through their every day-to-day problems, I think at that time I was still ramping up. So as a young primary care physician, when you first get started, they start you off very slow and then they ramp you up. Eventually, you're seeing almost 20 patients a day. So when I got to that point of 20 patients a day and I was looking at the patients, every day they will come, I will see them for 5, 10 minutes. Yeah, blood pressure, yeah, cholesterol, same old, same old. Here's your medicine, here's your medicine, here's your medicine. I said, no, no, this is ridiculous. I feel like I'm a robot. I cannot practice medicine like this. What am I doing with these patients? Basically, I'm doing cookie cutter medicine where I'm prescribing off a chart that they give us that this is your chart. Somebody has blood pressure, you start off this medicine, then you go to this one. So I was very much against that. I said, this is not something that, as someone who is going through all these training, you spend all this time working, you've been through medical school, you've raised kids, now still raising kids, by the way. You're now, working towards this goal of helping people. And this is not helping people. This is just giving them medication which anybody can do. A nurse practitioner can do it, a physician assistant can do it. So yeah, actually endorse that line of work. Okay, if you're here to just prescribe medication, anybody can prescribe a medication. But how did we actually help these women? That was the main question mark that I had. So I, said goodbye to this primary care and I went into the hospital medicine realm of things. And I liked it actually, but they gave me enough time, especially I guess the Duke hospital system, they give enough time so you can critically analyze a patient, spend some time with them. But again, this is critical medicine, sort of. It's not primary medicine where people actually need the help. And coming into why I started Crabtree Health, the number one reason was I wanted to make a women's health center, basically a women's focused health center where I could utilize. So I was fresh off the obesity medicine boards. I finished my boards. I understood obesity a lot better than what I ever did during the primary care days. It was not something that I was thinking about in a way when I was practicing medicine there. So it really changed the way that I thought about how I can help patients better. And once I finished my obesity medicine boards, I started looking deeper into what is driving female obesity in general. And that is a totally different ball game when it comes to obesity in women or weight gain in women, and particularly women as they head towards middle age. And so that was something that really started putting me into the picture of, okay, let's look at women's hormones. Let's see where it's helping them, where things are being neglected. So women after women, when I was seeing them, especially coming into the 40s and going to their 50s and early 60s, the main complaint was worsening anxiety, brain fog, weight gain that is difficult to control, even the fact that they are dieting. I always hear that, I've been dieting and I can't get this weight off. And, to this day, I hear these problems, numbers that are worsening, basically feeling overall sense of worsening PMS symptoms as they get closer to their periods. And so, I decided to look a lot deeper into this. And what I found when I did more studies into hormone replacement, how can we help women earlier on before they actually hit menopause, if they are going through these changes, how can they be helped earlier on to actually alleviate their symptoms and prevent them from further bone loss and even memory loss going forward by targeting things early? So part of preventative medicine, but not necessarily taught in the primary care realm. So that's the reason behind starting Crabtree Health. And I feel happy with the amount of work that goes into it. And even though my appointments last about an hour, sometimes even more, I think as a new practice, I give patients more time and more leeway, but really it takes that much time to understand people, to understand where the problem lies.
It's very good. Thank you. That's very good. I'm jealous of your patients because they get you for an hour, but that's okay versus my 20 minutes. Let's dive into the questions. So let's start with, you talked about perimenopause. So let's say, what signs should women look for in perimenopause and what often gets missed?
Yeah, so it's a very interesting time. So a lot of people, a lot of research studies show that perimenopause actually starts 10 years prior to menopause actually hits. And so, the body, so we live in an environment where chronic stress plays a major part. And I think, when it comes to women, we are the ultimate caregivers, call it. We care about our aging parents, we have children, we have our home lives that we are caring about. So the chronic stress also doesn't help. The environmental factors are there. We have a lot more processed foods, easy food availability, if you will. And so everything is dysregulating the hormones starting early on. So from younger ages, we're already feeling the effects of it. As we are in our 20s and 30s, we have the energy. Our adrenals are producing the cortisol. We are getting the energy. We are working through it. But then once the 40s hit, and as we head towards the 50s, we start noticing it. It's the fatigue. I feel tired. I feel, difficulty in concentrating like I once did before. I find that I forget things here and there. I find that, I don't have the same energy when I'm done. So this is a very common one. At the end of the day, I have no energy whatsoever. And I'm just, I don't want anybody around me. I just want to lay down in bed. And that's very, very common starting past the age of 40. So menopause, usually average age for women are between 50 to 55 in the United States. And every culture is different in when they're reaching menopause. So for South Asian, sometime even earlier, as a matter of fact. And for women per se, it really does matter how things were with your mom. Like if she had or she has, severe menopausal symptoms, most likely you'll probably end up acquiring that as well. Obesity also plays a role in it. So the worse, if you have to lose weight, that does dysregulate the hormones because our fat cells also can also store hormones as well. So that does dysregulate things as well. So some of these complaints are very common in a perimenopausal period. And as they head towards menopause, those hot flashes start coming a lot stronger, a lot harder. And that disrupts sleep, that worsens the anxiety, that increases the stress, that promotes weight gain. So it's a vicious cycle that just continues on. And then we are starting with menopause, bone loss. That's a whole different story.
It sounds like my cycle. Uh,
So many blessings.
Just keeps going.
Yeah.
Okay, so you say diet and stress, lifestyle habits that all play a factor into the symptoms. So what are your views on hormone therapy? Who should consider it and when?
So, the question is, being and honesty goes a long way when it comes to talking to the patients, if I may say. Not everybody is a candidate for hormone replacement therapy, but if you're looking into replacing hormones, if there is a sense that, okay, we are heading towards perimenopause, and you can usually, it's women that have reached the age of 40 and going past, sometime up to the age of 45. Studies do show that starting early hormone replacement therapy actually is protective towards memory loss, bone loss, and going forward having a better quality of life. So we worry here, we have a lot of factors that help us with the quality of life in general. And so everything is about improving quality of life. Women necessarily does not do not have to go through the anxiety, the mental stress. This is a very challenging time. Their children are getting older. Schooling could be a concern. Their parents are aging. So this is a very challenging time for women, particularly as they are in the perimenopausal period, which is past the age of 40. And so they're feeling all these feelings where it is difficult to control at this point. And it really does become difficult to control. Most people, when they're in their 20s and 30s, they're able to manage some of these stressors. The body is still adapt enough that it can accommodate it. The hormones are still not that imbalanced at this time. But once perimenopause hits and you start feeling fatigue, particularly at the end of the day, tiring fatigue, where once you used to have the energy to still go on and do things and perhaps read a book or something, and now it's completely collapsed. You're unable to do many of those things that you love to do. Sexual drive is another one. A lot of people find that they don't have the energy for all this. And it just like, I don't want to. It's just becomes like annoying, if irritating, if anything. PMS symptoms get worse, as you head towards your period. First, the period itself is starting to fluctuate. And people notice that it could be 1 day, 2 day, 3 days, the cycle starts getting off and the PMS symptoms just worsen over time. So those are the early stages where you can, start telling that, okay, perimenopause is coming. And most people, I've been surprised. They are reading up, they're understanding that these symptoms are coming on because they feel very different than once they were able to control things. And now just things feel out of control.
Yeah, I absolutely agree. I went through 8 years of perimenopause.
Yeah.
So there was a lot of ups and downs and a lot of things I didn't understand. That brings a really important point too, because I couldn't talk to my mom because it's not something we talked about. I didn't know anything about her journey, and she had a hysterectomy very early in her 50s. Um, but so to, do you feel that societal taboos or expectations affect how women approach this phase?
Yes, very much. I think, particularly in our society, and I'm from Pakistan too, the cultural background of things. um, we're sort of like, we're kind of the center point of the family, I would say, because in general, what are women doing? Particularly women from our culture, we are cooking, we are cleaning, we're taking care of the house, we are taking care of our parents, we are expected to figure out the educational component of the children. We're supposed to drive them back and forth if the husbands are working or whatever else is going on. So there's a lot of mental factors that go into it, and we're still supposed to continue doing these tasks as we reach towards the perimenopause and menopausal age. There's no thinking back. There's no saying, why is this changes happening? Should we be more supportive? Perhaps even like consider, okay, perhaps there's more time that is needed for rest and understanding. So the lack of awareness, and sad to say it, it's not just that it's not considered a disease per se. It's not talked about in circles. Nobody goes, unless I do a presentation on it and say, okay, we're going to talk about it in my culture and community that I live in. nobody knows about it really, and nobody really cares, really. It's that sort of a thing because we're very you know, I would say culturally, it's a very male-dominated, even community centers, if anything. So I would have to push for it. Like, no, we need to give time to the women. And believe it or not, when I do put a presentation on, they come because they want to learn about what's going on with them. And so to me, that's very amazing that it's such a difficult topic to talk about. But what I wish is that primary care doctors, they do learn about this because women are such a big part of primary care. And if you don't actually understand the hormone, which is a very difficult topic, by the way, the hormone imbalances, not everybody understands it. You have to read into it. You have to understand when and where to replace the hormones, where they're fluctuating. Can small amount of testosterone be used to help these patients? You have to delve into the world of compounded pharmacies, which a lot of FDA-approved medications will not do, and a lot of the insurance companies would not want to delve into. So there is some hindrance there, and I see it all the time. But I think as women, we try to push for it. And as a physician, I try to push for it in my community so that people have awareness. I also write blogs on my website. I used to make a lot of YouTube videos, but time is of the essence now. And it's hard to, find the time to talk on a podcast, unlike my friend. But I would say that sometimes it's very difficult to actually get the message across, but I do like to write. So what I end up doing is I write a blog and I post it on my website, and then I also post it on LinkedIn and other places so that other physicians can also read it, and women in our community can also read it as well.
Yeah, I like to write too. I write on my website too, blogs of how physicians can work with caregivers, and we can integrate this, this team environment. So that that leads me to, how can we as women, as South Asian women, support other women and ask our families to support us during these transitions? I mean, we need
Yes,
to talk about it more, right? So
absolutely. We
how
need
can we
to,
break those barriers?
yeah. And really it is, and Sonia, I'll be honest with you, it's amazing. First of all, I can't stress this enough. Read into your symptomology. Like people, they don't understand about what's going on with them. And I think as physician, it's our job to tell our patients that this is the changes that are going on. This is what I think that you should be doing. So I think number one, line is the physician itself. You should have a well-versed physician who understands the changes that are upcoming and can warn you and say, okay, these changes might get progressively worse. Let's consider doing testing. Let's consider checking and seeing if there is an imbalance. Let's look into your lifestyle. So that's the first line, where your physician is actually guiding you towards the right direction, because not everybody is reading medical books and figuring out what's going on with them, right? Although I would say there are many resources now available, particularly in the podcast world and in YouTube. I've read a few books myself. I think Mary Claver was one of them that I read about. And, there are some women physicians, OBGYNs, if anything, who are coming out and talking about it in the social media world, which is a great thing, actually. I think that's a good thing. Now, can they give wrong information? Yes. And so there's always a chance for that. So you do want to go to a certified or somebody who's a professional who does understand, can look into you as a person as opposed to what podcasts are telling you. And so there is that initial line where there is some awareness now that is being created around this. And I think social media is helping people become more and more aware as time is flying by. Now, the second part is also letting your family or having your family understand this. A lot of times, because we come from generations where women were not complainers, they were doers. They would do and do and do, right? We can still be doers, as a matter of fact. We just have to do it in a different way. And so that concept, to explain this, putting yourself out there as someone who is able to almost achieve everything in your 20s and 30s, and taking a little bit of time for yourself now as you head into your 40s and your 50s, this should be something that should be a right of yours. You should be able to do that. You should be able to spend the time with yourself, with your mental health, because I actually, and I just saw a lady today, when she talked about exercise, I actually told her this is part of your prescription. Like you have to do it as if your life depends on it. So it shouldn't just be, okay, yeah, I will make the time for this and that. Say, no, you need to make the time. Your work is there, I understand, family members are there, I understand, but they should also be understanding that these things are important to you. So we do, if, I would say as a physician, I wish, we had time, and sadly not in the corporate physician world because of the lack of time that can be given to the patients. I can't explain, like if physicians had the time, they will. They know the knowledge. They just don't have the time to express this. But self-education is also important. I'm really a big proponent of that. Read blogs, listen to the female physicians out there who are actually talking about this topic because it's a very wide topic now. A lot of social media are pushing for people to understand this, and hopefully some of the men will listen too. So, it could be an equal sharing of knowledge, if anything.
That's interesting. You noted Dr. Marie Claver. She's the one I actually started following her last year on Instagram, and I had no idea about HRT. And because of her, I went and did my research because she's also an influencer, so she does sell some
Yes.
product, but she does come with research. And so I look up all the research IDs that she posts and I read through them, and that's why I went to my doctor and said, look, and in my chart notes, my doctor puts follow social media influencer, blah, 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 because of like she didn't want to get
That's
blamed.
AI.
That if something went wrong, it was because of this social media person. It was so funny. Anyway, but so just the final thing is, you talked about it a little bit, but how, as since we are all caregivers in some level of care somewhere or the other, I know many are actually all going through this transition or maybe postmenopausal, but also are dealing with mothers who could also be postmenopausal. So what's the best way to navigate these symptoms as well as help our aging mothers who are also going through these? There's
Yes.
there's a lot
Yeah.
there.
It's a it is a challenging situation for sure. So a lot of times, once menopause hits, you cannot be a candidate at that time for hormone replacement therapy. Anybody says otherwise is saying it incorrectly because unfortunately chances of cancers go up at that time. So the goal of hormone replacement therapy is more in the earlier stages when you are in the phase of perimenopause. And that's when you are actually utilizing the effects of the hormone replacement, because earlier start actually is preventative on many aspects. The second part is, with women that have already reached menopause. So at this time, other factors do become important. So lifestyle becomes important. Having a, proper nutrition, still incorporating those muscle building exercises become important. So those are some of the importances that still play a part during menopause in itself. Is it too late to do all that once we do hit menopause? No, not necessarily. It is still a good lifestyle that you want to lead at and also prevent yourself from actually breaking a bone going forward, or God forbid, heading towards dementia going forward. So preventative things are still preventative. So you can still work on your nutrition, still take your supplements. There are many supplements out there that are somewhat regulated, if anything, that can actually help with some of the symptoms of menopause. I don't say all of them because they are not prescription medications per se. They're not as strong. They do take their time. But they were used, a lot of people back in our cultures, they have been using natural herbs, natural supplements. So most medicines are derived from natural supplements. They're just synthetically changed. So there's no, I would say a stigma associated with it, but I would say that there is a regulation that is required. You cannot just take this supplement that is posted on YouTube or Facebook because it may not suit your body, as a matter of fact, or that may not be the supplement that you need. When it comes to hormones, you have to be careful what you take. You have to know which hormone is missing or is low, basically, and that which supplement is actually going to target that. As far as caregiving is concerned, that is a very challenging time in itself. So the mental stress that comes from it, and coming from my own story when my father was going through his stages of dementia. And one of the reasons that I moved to Raleigh, North Carolina, was because he himself was battling a very rare type of dementia, which we couldn't figure out. And so, lo and behold, I said, well, what about, frontotemporal dementia? And, his primary care doctor was like, no way, he's not losing his memory, but he's behaving very odd. So, as a family member, you always have to advocate. Thankfully, I had some medical knowledge behind it, and he got tested, and it was positive for the kind of dementia he had. And so that was very challenging for us as a family. Now, did that affect my stress levels? Yes. This is a loved one who is suffering. We don't know what's going on with him. There's no doctor, there's no cure for dementia, right? So it's a terminal diagnosis that's just been given to him. And as a family, how are we going to come together and take care of him and work and take care of our children? So I understand the dilemmas that go through it. I mean, there was many times that tears would flow because we just didn't know how to handle this situation. But I will say this, now that I have matured, from looking into that situation, there is an essence where that stress actually does play a part as I am going forward in my life. I do feel that I've taken chronic stress over time, and that stress had played a major part in disrupting my hormones to a sense. And that was not just my dad, the medical school itself, having children themselves, like, worrying about their schooling and all that. So now I come to the realization, and I'm in my 40s now, I come to the realization that, I don't want to head towards a path where I'm going to feel the effects of the stressors lifelong with worsening anxiety, worsening stress, worsening mental symptoms, brain fog, and even worsening menopausal symptoms because chronic stress does drive symptoms of hot flashes. And so when we understand that, we need to start taking a step back and looking into ourselves and saying, okay, where can I seek assistance? Where can I seek help? What resources do I have available in front of me? Which family members are willing to chip in to help me out so that I can also enjoy things in my life that I enjoy? And that's such an important part. We have to take that time out to enjoy things in our life that, are enjoyable to us. Reading a book, perhaps going for a walk, perhaps spending time with the kids, perhaps watching a movie. I mean, watching the dramas or whatever. But that is something that is joyful to you. And every brain needs that break once in a while. It does need that mental break. Otherwise, you are heading towards stress over stress over stress. Then development of prediabetes, elevated cholesterol, inflammatory markers, heart disease, blood pressure rising, palpitations. I just saw a woman today and her stress is driven by work, a lot of work. And so these are real stories of people and they do happen. But, I would say people also need to take the time to sit back and analyze their life and understand that these are not good for our physical and mental health. We have to, let nature take over where it does take over. And we have to step back and say, okay, you know what? This is the time where I have to also look into myself and see where I can find the time to de-stress. Do I need hormone replacement? Do I need to discuss with a specialist? Do I need supplement assistance? Can there be supplements that can help calm things down for me? And many times, we do utilize supplements too, because they do help people with sleep, regulate their sleep. Do I need to get assessed for sleep apnea? My health should be optimal. If I have to take care of this person, my health should be optimal. So that's a thought that everybody should hold.
Really valuable, and I agree. Um, well, does anybody have any questions? Now's the time to ask. We have a few minutes left.